So do you want to actually introduce that? Maybe that's better.
Right. Yeah. Professor Tian is a accomplished neurosurgeon and a pioneer in the field of image-guided neurosurgery. Yeah.
Firstly, thanks for every attending our express because I'm late because of tragic reason. So sorry for that. Okay. So this is the first time I go to come here, England, and as a part of the project of WES with Professor Xiaohong, so I come here with my team, so team group. So I will give you some express about our works. So how image guided the stereotactic operation in our experiments. So if you have any question, just ask me, okay? So we did this. Maybe coming to sit there. We did this have a long time for this because we used the image guided the operation, neurosurgery operation. The first we must find the target in the brain, and then we input some medicine or some monitor to detect the function, the brain function. Yeah. So we did a lot of cases from the 1997 to August 2013. We performed over 6,000 cases for such operation. And the age between the below 1 year to 90 years. We did this because we want to treat the brain tumor and some brain hemorrhage. Also, we did some endoscope surgery. We have also moved the mental, the foreign body, for example, the body in the brain. And we also detect some small lesion in the brain. And also we observe some abscesses. This is the classification of our operations. So we can find the intratumoral irradiation. The most cases we did this. Because we input some isotope to irradiation treat the brain tumor. And other things we do some biopsy. Very important things. If we found some cases have the brain lesions, we must detect what kind of disease and is that a tumor or infection or such or other disease. So we can treat with the therapy, radiotherapy, or just remove it or just use the antibiotics. So biopsy is also most important. We also treat some brain lesions with the transplantation stem cell. Treat some very difficult to cure such disease. That's about 15 years ago. We first used the robot to treat the brain lesions. This is a boy. We use the tumor. We call the tumor the robot to treat that disease. And then we developed some machine. We also call the robot to analyze and to have a location of the such brain disease. We see the 2005 years, we have the fourth generation of such the armed robot to have the detector, the target, and we use the telecontrol. That's happened between over 60 kilometers away, the different cities. We use some technique. Now we use this kind, use some monitors eyes to have the distance measure to ensure the treatment is safe. And now in China we have such, we call the products, medical products machine to use in many cities. Why we invited such instrument? Because as we know, in neurosurgery now in the world, the most unit use such we call the frame stereotactic instrument. First, we need fix some frame on the scan, and then we input some instrument to use this to calculate and to have found the target to treat that. And we use the robot. The main purpose of use to have some frameless instrument. Let's just have some mark on the hand, and also we use the robot just control it to have the function. So compare with the two parts, you can find that for the patient, they don't need the frame, so have less pain and also have relaxed. And for the doctors, less convenient for doctors because we have no frame. Observe the doctor's position to treat that. And we can see after operation, we just a very small hole to treat that. This is the operative, we can see just one hole. Because we use frameless stereotactic operation, so we only need the local anesthesia in most cases. For some general analysis, for some small child or some patient that couldn't to cooperated with you, so the last part we use that. So now we see our operation procedures. First, we just put some markings on the head, and then we have the MR or CT or even PET, the scan, to find the mark. We use the computer to have some surgical plan. We call the surgical puncture weight, and use the robot to point and into the brain region. That have the navigation to have some puncture, and then we can inject some medicine or have some physical or chemical therapy to treat. For example, we treat some cases for this, for small child, we use navigation. And we also have some extra fluid. That means, for example, the cyst in the brain and hematoma, we take it off. For biopsy, I just mentioned to have a diagnosis, the And for the tumor, we injected some isotope. We also use some after-loading radiotherapy to have some tube in the brain tumor. And then we use some isotope into the tube, into that the lesion. After that, we take the radiotherapy out. And this is an example. We take some, we call some for body, for example, balance in the brain. We navigation and take the load. Yeah. And the results, all cases, we have navigation successful. Yeah. And only operation take about 30 minutes. And no the serious side effect happen. And this is our result. Now I have some cases I can show you. The baby have the brain stem tumor. That's a system. So we can have the round point and effect to evaluate the fluid. And after operation, only maybe 2 hours, yeah, we can treat. And this is for abscess, the deep brain abscess. A girl have that. So we have that picture and observe this problem. And after operation, she can go away from the operating room. And usually, such cases, we use open surgery, I mean craniotomy, to take into the abscess. So that's a serious injury to the patient's brain. And for such treatment, we can get, we can get the good results. And this baby from Sweden, coming to our hospital. We have this neural stem cell transplantation, and use this technique. And this disease brain tumor, that's called a craniopharyngioma. That's very difficult to cure, because if we resection total, it will have the very bad results, because the side effect much more. And use this technique, we just injected some isotope. We have found after 4 years the tumor disappeared. Such cases, the big brain tumor, and about 8 years, yes, the tumor disappeared. And that's the other cancer, the tumor. We put into the isotope. That's I-125. We put into, and then we can find the tumor post disappear. So for some unreason, the lesion of the brain, we have biopsy. Use the MRS. We call the analysis, which area is a very interesting area. So we can put the puncture and find we have the interesting area to have a biopsy. And we can find the reason of the lesion. This kind of disease is very common in the neurosurgery. We call it glioma. For the malignant this disease is quite difficult to treat. We use this technique can have some much more effect than before. And we also use some PET guided such injection instruction for that. Yeah. And we found this area is what we call the interesting area, so we can have biopsy and find it's lymphoma. For lymphoma, we can use radiotherapy or chemotherapy, so we don't need to open the brain. This is a lymphoma, for example, yeah, before operation, before the therapy and after therapy. And we will also use the endoscope to use this robot to guide it to do some operation. For epilepsy, we use such instrument to input some we call the electrode for the monitor, the EEG, and found the lesion of the brain that has the epilepsy, that's an epilepsy reason, so we can destroy that and to cure the epilepsy. And this epilepsy, we have the electrode, yeah, into the brain, and found, for example, the second electrode have some we call the epilepsy waves, so we can detect that and destroy that. This is a before and after operation. We found the EEG improved. So we did some cases. Just I mentioned, we convenient for the doctors and also convenient for the patient. And we use some technique, have we call the tele surgeons for one city to other cities. For example, while in Beijing, we have the case in the Shenyang that's about 6 kilometers away. That's hematoma in the brain. And I can use a computer control the robot in that city and control this robot to point the lesion of the brain. And the neurosurgeon in that city can use this instrument to have some, we call the target location, and also puncture, take off the brain hemorrhage. Fortunately, we published some papers with the help of Xiaohong, the professor, and he wants a lot of help, so thanks a lot. And in some textbook, Stereotactic neurosurgeons, our papers are also related. Now we have the small robot arm to take it to the ship to go the other countries, and in the ship we can perform some operation. We also use in the spine surgery. Let's mention we use the robot. That technique is guided, is image guided to something. And the other part I can show some cases with the stem cell. We try to use this technique to treat some cases. I can just show some cases, I think. Yes, that's in our laboratory. We calculate some stem cell. And we also did some animal model to test that. For example, this Parkinson model. Yeah, you can see the rest around the over 7 cycles per minute. And after 3 months, when we injected some stem cell, it will recover normal. And we also have some pathology findings. The stem cell, after this puncture, it can move the other part. Yes, we use the stereotactic operation to point we call the V or the nucle to input that and improve some cases. This Chinese painter, before operation, he couldn't write his name, say his name, and after operation, 8 years, he sent me this paper. Now it still works. For example, the Parkinson disease, it moves very slowly before operation, especially. And after operation, 1 year, improve a lot. And this is the schedule. He can have some very famous products in university. Before operation, he couldn't work. And after operation, 2 years, he can work very well. This is another case from an American when he has suffered from the Parkinson disease, and we also use we call the deep stimulation, the DBS stimulation, and no use for him. And in our hospital, we treated 1 year later, he can work as we use some pad to find the stem cell works. And we also can find it can cure some we call the muscle spasm disease. This is before operation. This is after operation, 2 years. And this also we call the before operation. And this after operation, 2 years. He is a university student, and now he finished that and works in our company. This is a very serious brain lesion. This is before operation. His father helped him. And after operation, 9 months, improved a lot. He can write his name. And also walk a little. So for some very deadly disease, we call the button disease. That's uncurable disease in the world now. It's from Sweden. We treat such cases 5 times, and until now, 10 years passed, and he still alive and improves. We also treat a girl from England. Yeah, also has some improvement. And a reporter from Sweden Voice take this picture published in the U.S. Popular Science. That's in the 2007 years. And we published some Chinese books. And as an emission, a group, and my teacher, and also my colleagues helped me a lot. So I thank all of them. So I just give you some introduction about our work. That's maybe not helpful, but we think that our request will give some rule about the image, how guided the neurosurgeons to deal move, I think. Okay. Thanks a lot.
Questions? Yeah,
Thank you very much for the excellent talk. It is really amazing to treat patients when they're in very, very bad conditions, and after like a year or two, they recover very nice. I was wondering, you have shown us quite a lot of cases using this technology to treat diseases, brain diseases. Have you tried to use this to treat other diseases apart from brain? For example, like tumors in the breast or other part of the body?
Oh, yes. For such cases, we just, because neurosurgeon, I just mentioned our field. We also treat some lung cancer. For biopsy, and use some physical therapy. I mean, the cooling and the heating the therapy to cure that.
And it's also very successful.
Yeah, that's right. Also.
How about breast cancer?
We have that chance. I think that biopsy also can use for that scanning. That's maybe easier. We treat some for spinal cord, I just mentioned, yeah, spinal cord tumors, yeah, and the spinal cord cyst to puncture. Yes.
Okay, to second this is amazing success stories there using your technology. I was wondering what are your competitors? So what is a competing technology? What is an alternative, and how do they compare with what you're doing?
You mean the conventional therapy and our...
Right, so how are they scoring?
Yeah.
What are the results?
Basically, we based on the modern technique, and then developed the Frameless technique. Because we from 1980s we invented the instrument from Sweden we call the Stereotactic frame. That's in that time that's the most we call advanced instrument, and we treated in China a lot of cases, and then we found for some I mentioned for some boys and for some patients that couldn't compare or cooperate with the doctors, so Frameless have the more advantages. Besides, we also can use the telesurgery, use that technique. So we developed this with the university, we call it Beihang, university in China. We cooperated for over 10 years, cooperated and developed the generation to generation.
And is someone else using frameless technology, or like in the US or somewhere else?
Oh yeah, in France.
Yeah.
In France, they also invented some, we call ROS, ROS. That's automatic robot. We also do that.
But they are now operation in the US and Europe. And they are only allowed to do kind of a deeper brain simulation.
Okay.
So it's in Europe, you can't see the operation in this way.
Because of
Because they don't have a license or some other things.
Uh-huh.
Yeah.
FDA approval or something.
It's related to stem cell treatment.
Yeah, maybe.
Related to
Yeah, in such for example, stem cells,
Yeah.
we also have some, we call the technique and the sense and technique, the national permit to do some, because small cases, not so much. Yeah.
Someone else?
I have one question.
Yeah.
Okay.
So earlier you mentioned the Parkinson's disease and also the epilepsy. So it seems very effective. So this technology is widely available for the public in China or?
For surgeons, at first we call the indications. Yeah, some cases use medicine can have the good results. We don't use surgeons. For example, so for Parkinson's disease, maybe half of them they just need the medicine to we call to control that symptoms, because that's a long time for long period for patients. And for some, medicine couldn't recover problem, so that's choose the surgery. For surgeons, there are also some different methods. For example, to destroy the lesions. Yeah, for some cases, I mean for Parkinson's, that can have some results. And also in the world now, we use we call the DBS, deep brain stimulation. That's a common way to treat that. But some cases use two methods. These two methods have found some results, so we use those methods to treat that. That's what I want to treat that.
Any more questions?
I just have a question about these patients. So you showed some percentages of success, and so these patients they were cured. Well, I mean, obviously there were some very good results, but were there cases that the patients relapsed back to previous condition, or they were cured for a very long time, and it's not known if they relapse, or is there some?
Yeah. Now I mentioned all cases is suitable for the stereotactic operation, the first one. And the second, for stereotactic, we use the two ways, the frame and the frameless. I mentioned in this lecture, I just mentioned frameless. And the frameless also can use some new technique, for example, stem cell and other technique. So today I just mentioned two parts. One is the frameless, that's image guided, and the other is the stem cell, that's the biological, the ways to treat the brain disease.
Okay, thank you very much.
That's